Which structure of the nephron is primarily responsible for filtration of blood? A. Loop of Henle. B. Bowman's capsule. C. Distal convoluted tubule. D. Collecting duct. Answer, B. Bowman's capsule surrounds the glomerulus and is the initial site of blood filtration in the nephron. The sinoatrial, SA, node is often referred to as the heart's A. Electrical switch. B. Natural pacemaker. C. Contractile center. D. Ventricular regulator. Answer, B. The SA node generates electrical impulses that regulate heart rhythm, functioning as the natural pacemaker. Which cranial nerve is primarily responsible for facial expressions? A. Trigeminal nerve, V. B. Facial nerve, 7. C. Glossopharyngeal nerve, 9. D. Accessory nerve, 11. Answer, B. The facial nerve controls muscles of facial expression, salivation, and taste sensation from the anterior tongue. Which type of joint is found between the radius and ulna allowing pronation and supination? A. Hinge joint. B. Pivot joint. C. Ball and socket joint. D. Gliding joint. Answer, B. A pivot joint permits rotational movement, such as the radius rotating around the ulna. Which hormone increases calcium levels in the blood by stimulating bone resorption? A. Calcitonin. B. Insulin. C. Parathyroid hormone. D. Cortisol. Answer, C. Parathyroid hormone increases blood calcium by stimulating osteoclast activity and calcium reabsorption. The functional unit of the liver is called the A. Lobule. B. Nephron. C. Follicle. D. Alveolus. Answer, A. The liver lobule is the structural and functional unit responsible for detoxification and metabolism. Which part of the brain controls balance and coordination of voluntary movements? A. Cerebrum. B. Cerebellum. C. Medulla oblongata. D. Thalamus. Answer, B. The cerebellum integrates sensory input to maintain posture, balance, and coordination. Which blood vessel carries oxygenated blood from the lungs to the heart? A. Pulmonary vein. B. Pulmonary artery. C. Aorta. D. Superior vena cava. Answer, A. Pulmonary veins carry oxygenated blood from the lungs to the left atrium. The thickest layer of the heart wall is the A. Endocardium. B. Myocardium. C. Epicardium. D. Pericardium. Answer, B. The myocardium is the muscular middle layer responsible for contraction of the heart. Which cell type is primarily responsible for producing antibodies? A. T lymphocytes. B. B lymphocytes. C. Monocytes. D. Neutrophils. Answer, B. B lymphocytes differentiate into plasma cells, which secrete antibodies for immune defense. Which muscle is the primary muscle used in normal inspiration? A. Intercostals. B. Pectoralis major. C. Diaphragm. D. Serratus anterior. Answer, C. The diaphragm contracts downward, creating negative pressure for inhalation. Which vitamin is essential for normal blood clotting? A. Vitamin A. B. Vitamin K. C. Vitamin D. D. Vitamin B12. Answer, B. Vitamin K is required for synthesis of clotting factors 2, 7, 9, and X. What is the functional unit of the lung where gas exchange occurs? A. Bronchiole. B. Trachea. C. Alveolus. D. Pleura. Answer, C. Alveoli are microscopic sacs where oxygen and carbon dioxide are exchanged between air and blood. Which type of muscle tissue is involuntary and striated? A. Skeletal muscle. B. Smooth muscle. C. Cardiac muscle. D. Tendon tissue. Answer, C. Cardiac muscle is involuntary, striated, and contains intercalated discs for synchronized contraction. Which part of the eye regulates the amount of light entering the retina? A. Lens. B. Iris. C. Cornea. D. Retina. Answer, B. The iris adjusts the size of the pupil to control light entry. The adrenal medulla produces which hormones? A. Cortisol and aldosterone. B. Epinephrine and norepinephrine. C. Insulin and glucagon. D. Thyroxine and calcitonin. Answer, B. The adrenal medulla secretes catecholamines, epinephrine and norepinephrine, during stress response. Which type of connective tissue stores fat? A. Cartilage. B. Adipose tissue. C. Dense regular tissue. D. Areolar tissue. Answer, B. Adipose tissue stores lipids for energy and cushions organs. Which electrolyte is most critical for cardiac muscle contraction? A. Sodium. B. Potassium. C. Calcium. D. Chloride. Answer, C. Calcium ions are essential for excitation-contraction coupling in cardiac muscle cells. The main function of the large intestine is to A. Absorb nutrients. B. Absorb water and electrolytes. C. Produce digestive enzymes. D. Digest proteins. Answer, B. The large intestine primarily absorbs water, forming solid feces. Which structure prevents food from entering the trachea during swallowing? A. Uvula. B. Epiglottis. C. Pharynx. D. Soft palate. Answer, B. The epiglottis closes over the trachea, directing food into the esophagus. Which blood type is considered the universal donor? A. A+. B. O-. C. A+. D. B-. Answer, B. O- lacks A, B, and Rh antigens, making it compatible with all recipients. Which layer of the skin contains sweat glands and hair follicles? A. Epidermis. B. Dermis. C. Hypodermis. D. Stratum bile. Answer, B. The dermis houses glands, follicles, nerves, and blood vessels. Which endocrine gland regulates metabolism through thyroxine production? A. Pituitary. B. Thyroid. C. Adrenal. D. Pancreas. Answer, B. The thyroid gland releases thyroxine, T4, controlling metabolic rate. Which part of the nervous system is responsible for rest and digest functions? A. Sympathetic nervous system. B. Parasympathetic nervous system. C. Somatic nervous system. D. Central nervous system. Answer, B. The parasympathetic system conserves energy, slowing heart rate and promoting digestion. Which artery is commonly palpated when checking a patient's pulse at the wrist? A. Brachial artery. B. Ulnar artery. C. Radial artery. D. Carotid artery. Answer, C. The radial artery is superficial at the wrist, making it ideal for pulse assessment. Which structure connects skeletal muscles to bones? A. Ligaments. B. Tendons. C. Fascia. D. Cartilage. Answer, B. Tendons attach muscles to bones, enabling movement during contraction. Which organ produces bile to aid in fat digestion? A. Pancreas. B. Liver. C. Gallbladder. D. Small intestine. Answer, B. The liver produces bile, which emulsifies fats for easier digestion. Which type of white blood cell is most abundant in circulation? A. Lymphocytes. B. Neutrophils. C. Basophils. D. Eosinophils. Answer, B. Neutrophils are the most common WBCs and play a key role in fighting bacterial infections. Which part of the ear converts sound waves into electrical signals? A. Tympanic membrane. B. Ossicles. C. Cochlea. D. Eustachian tube. Answer, C. The cochlea contains hair cells that transform vibrations into nerve impulses. Which body plane divides the body into right and left halves? A. Coronal plane. B. Transverse plane. C. Sagittal plane. D. Oblique plane. Answer, C. The sagittal plane divides the body longitudinally into right and left portions.